Well, the numbers are shocking. Half of all adult Americans suffer from a chronic disease. That's 117 million people, and their poor health costing the country a whole bucket of money. Our next guest says turning to technology won't just save lives, it'll cut medical spending. Dr. Asif Ali is a cardiologist for the Houston Rockets. It's a cool job. And chief medical officer of the telemedicine company Fruit Street Health. Nice to see you this morning, Doc.
Hi, good morning.
First of all, Houston Rockets. What a cool job that is.
Yeah.
Are you there like every night at every game?
Not every night at every game, but I get to interact with them.
So you're also an entrepreneur, and you created this incredible idea of Fruit Street, which is telemedicine. The idea that we don't necessarily need to be in front of our patients constantly. We can use technology to figure out what's going on with them. How does this work?
Yeah, absolutely. So if you could imagine using a wearable device, stepping on a scale, taking pictures of your food. I call it a selfie with your food.
Right.
And then having a nutritionist or a health coach or even your healthcare provider look at that data and feed back to you. It's all about your diet and lifestyle changes.
One of the things I love that you say as a nation, we must shift from treatment to prevention. And with a lot of these wearable devices, take, for instance, the Apple Watch or Fitbit or any of these other devices, we're actually monitoring data ahead of time. So we're not putting on the extra pounds. We're putting in the calories that we're eating. We're tracking our steps. How important is it for us to be, as a nation, focusing on prevention?
Prevention is the key. I mean, we're talking about healthcare dollars here, and the real healthcare dollars that are associated with chronic care conditions like obesity. I mean, over a third of America are considered obese, and that's really impacting our healthcare dollars.
So one of the main issues you have to deal with, though, is the federal government at Fruit Street, right? So you're having to deal with HIPAA compliance, you're having to deal with regulations. How can you guys be out in front on technology with the ancient dinosaur that is the federal government that hamstrings you from getting this accomplished?
Yeah, I mean, yes, it is a difficult task, but what Fruit Street is a HIPAA-compliant portal to take information from your wearable devices and integrate that through telemedicine portal. So I agree with you. These devices have to go through the FDA, and that's a arduous process. I mean, you've heard about the Apple Watch recently.
Well, Tim
going
Cook this week saying that he didn't want the federal government to be regulating the watch, that they thought their other components could work with the watch because it would just slow up development to deal with the federal government.
Yeah, that's right. So we need to streamline those processes. I mean, we need to be able to collect data. The consumer wants this, right? They're consuming these wearable devices, and it's incumbent on us to make sure that we get that data.
What's the feedback been? I remember when I lived in southern West Virginia, wonderful, wonderful place, but the closest heart hospital was over an hour away. Being able to have that interaction with a healthcare provider in a rural area of this country, what's been the response? Yeah,
I mean, consumers want healthcare where they want it and when they want it. So, I mean, absolutely, the consumers, the patients are asking, and we as providers need to be able to give.
Wonderful. So people can learn more at fruitstreet.com?
That's right, www.fruitstreet.com.
Dr. Asif Ali, I appreciate joining us this morning. Houston Rockets tickets, if I can get down there?
Come down.
All right.
We'll take care of you.
Thanks, Doc.